Cycling is a popular form of exercise that can offer a variety of benefits. But one of the questions that often comes up is whether or not cycling is good for knee pain. In this video, we're going to explore that question in detail. First, let's talk about knee pain. Knee pain can have many different causes, from overuse injuries to arthritis. In some cases, knee pain can be exacerbated by certain types of exercise, while in other cases, exercise can actually help to alleviate knee pain. For example, high-impact exercises like running can be hard on the knees and exacerbate existing knee pain. But cycling is a low-impact exercise that can be much gentler on the knees. In fact, cycling can be a great way to improve knee strength and flexibility, which can help to reduce knee pain over time. One of the reasons cycling can be so beneficial for knee pain is that it is a non-weight-bearing exercise. When you cycle, your body weight is supported by the bike, so there is less stress on your knees than there would be if you were running or jumping. Additionally, cycling is a great way to build strength in the muscles surrounding the knee. When you cycle, you use your quadriceps, hamstrings, and calf muscles, all of which can help to support the knee joint and improve knee stability. Cycling is also a great cardiovascular exercise, which can help to improve overall health and reduce inflammation throughout the body. Inflammation can be a contributing factor to knee pain, so reducing inflammation through regular exercise can be very beneficial for those with knee pain. Of course, it's important to note that cycling isn't a cure-all for knee pain. If you have an injury or underlying condition that is causing your knee pain, cycling may not be the best form of exercise for you. It's always a good idea to talk to your doctor or physical therapist before starting any new exercise program, especially if you have knee pain. In some cases, your doctor or physical therapist may recommend modifications to your cycling routine to help reduce knee pain. For example, they may recommend adjusting your seat height, changing your pedal stroke, or incorporating more low-impact exercises like swimming or yoga into your routine. Ultimately, whether or not cycling is good for knee pain will depend on the individual. If you have knee pain and are considering cycling as a form of exercise, it's important to start slowly and gradually increase the intensity and duration of your workouts. Pay attention to your body, and if you experience any pain or discomfort, stop and take a break. Overall, cycling can be a great form of exercise for those with knee pain. It is a low-impact exercise that can help to improve knee strength and flexibility, reduce inflammation, and improve overall health. However, it's important to talk to your doctor or physical therapist before starting any new exercise program, and to listen to your body as you start cycling and building up your fitness level. With the right approach, cycling can be a safe and effective way to manage knee pain and improve your overall health and well-being. So if you're dealing with knee pain and are looking for a low-impact exercise that can help you stay active and healthy, consider giving cycling a try. With its many benefits, it just might be the perfect exercise for you. Thank you for watching. If you found this video helpful, please like and subscribe to our channel for more informative videos on health and fitness.